How are you?
I'm good. How are you,
I
Marnie?
think I have to adjust you here. I see like the top of my head on the screen.
Yeah, I can sit back, adjust yourself, take your time. We'll wait a few minutes for some people to arrive. So all good.
Okay. Oh, hold on. I thought I had it fixed, but I guess I don't. I'm going to lower myself and see if that works. I think that's about as low as I'm going to go.
Okay, works for me. I should actually probably lower this a bit too for myself. All right, cool. How is your Easter Monday?
It's good. It's good. It's been busy. I've had a lot of virtual consultations. So
Oh, nice. Are you doing any Easter dinner? Do you celebrate?
I did dinner last night with my mom.
Nice.
Yeah. But
How is the weather where you guys are?
it's beautiful. It's 70 and gorgeous today. So it's
Oh
nice.
my gosh. It's just starting to warm up here, but it's in Celsius and it's 8 degrees today, so we will take it.
Yeah.
All right, cool. So, Marnie, what I was thinking is I kind of wrote up a little agenda. I thought we could go through it just so that our viewers will have an idea about what we're talking about today and then save some questions for the end, and then we can get to that. How does it sound?
Sounds good to me.
Perfect. Okay, what did I write down? Okay, so first off, I just want you and I to introduce ourselves and just spend a few minutes describing your career and then how you got to where you are today.
Mm-hmm.
And then specifics around paramedical tattooing, the areola tattooing that you do, and why PMUs would and should add these tips to their business. And then we'll hit questions up. How does that sound?
To me.
All right, let's do it. Okay, Marnie, tell us everything about you.
Oh my goodness. Well, that could take a while, but I'll tell you what led me to this. So in 2013, I was working on Wall Street and diagnosed with the breast cancer gene mutation.
Yeah.
That I was diagnosed with DCIS, or ductal cell carcinoma in situ, which is also known as stage 0 breast cancer.
Oh.
I was also a thyroid cancer survivor, and I believe we have that in common.
We sure do.
So I started thinking about my experience and how uncomfortable I was, and that led me to become really passionate about helping other people. And I designed the Billow pillow, which is a mastectomy pillow for post-mastectomy patients.
Yeah.
And as I was speaking to these patients and going to support groups, I soon realized that there was something else missing, and that was the need for areolas.
Yeah, for sure.
Had them removed, and there wasn't an option for them in my community for tattooing. So I did a lot of research on the topic, and I said, this is something that I'd really like to try. So I took a class, I became certified, and I've been doing that. I've been doing it for 3 years now. As I started doing the areola tattooing, people were asking me about brows. I've had chemotherapy, my brows have fallen off, I've lost my hair, can you help? And so in my search to find other ways that I could help, I also trained in eyebrows, scalp micropigmentation, and some other areas where I could really help the survivors feel complete again, and it's that in pretty much a nutshell. I've been doing it for 3 years now, and I've expanded my services in different states, including Pennsylvania, graphics, New York, and New Jersey.
Oh my God, that's amazing. So your story is that you actually got into areola tattooing first,
Right.
And then added the cosmetic.
Right. People do the opposite.
Oh my gosh, it's unusual. I have a similar story, except I did both of them together, which is probably equally as rare. So what's a day in your life now where you work? Would you say it's mostly paramedical, or do you have a split with cosmetic?
Well, initially it started out 100% paramedical, and
Yeah.
it was because that is my main focus. So it was areola tattooing and scar camouflage and scar management. So, for example, if if a patient comes to me and their scars haven't healed significantly, even after the 4 to 6 month waiting period that I like
Yeah.
to have them wait before even touching their skin, I'll recommend a scar management protocol, whether that is silicone gel adhesive strips
Yeah.
or needling before I even do the tattooing, because I want the best result, right?
Yeah. And I think there's so much of that within that patient's control that a lot of them don't even know about. So I certainly love getting my hands on them at that early stage of healing, because a lot of times you can improve the texture and color and look of that scar by 50% by doing proper healing and massage. And yeah, it's not known about. And I'm often surprised that the doctors don't recommend it. Or if they do, it's for such a short period of time that I'm like, no, keep doing this until we get together to actually tattoo.
Yeah, and that's one of my frustrations is, you know, I get a lot of patients who are injected with steroids in their scars or they're laser.
Mhm.
And I ask them every single time, how did it work? Do
Yeah.
you feel healed? Do you feel like the scar is better? And the answer has always been no. And
Yeah.
it even makes it worse. And so I really would like to, just maybe it's just unawareness. A lot of the doctors do stand behind microneedling, microchanneling,
Yeah.
and they offer some different devices, or they have different devices in their office to provide the service. But I really wish they would talk about it more. I really do. So anyway, so it was about 100% medical and paramedical,
Yeah.
and I started to bring on the other services. I found that the clients who I'm doing the areola tattooing for really do want the brows and the scalp micropigmentation. So it's mostly those clients that end up getting it. So now it's
Yeah.
probably, 75% medical
Yeah.
paramedical, rest is brow, lip, blushing. I mean, that's
Yeah.
just for scalp micropigmentation. But there are also people that, have scars on their lips that need treated as well. So
Yeah.
there's a
I
paramedic
find
to
Sorry,
that.
I find the same too, except in my cosmetic business, they'll come in and see that there's areola work being done or stretch marks or scars and burns. And then that prompts another conversation to end up, turning into paramedical. And it's interesting now that I feel that this industry is starting to get more momentum. And so people aren't as, you know, confused and like just had never heard of it. I mean, I think it's still in its infancy, as I'm sure you could probably agree, but I feel that, yeah, there is a little bit of a wheel in motion starting to happen there. And I love that because I'm sure probably for both you and I, it's something that is not only so rewarding, but it's a part of your day that you can't ever compare to anything else. Paramedical is just a whole nother ball game. And the how gratifying it is for not only you and that patient it's almost hard to describe it.
Yeah.
It's What would you say about that?
Um, it's one of the best feelings in the world to be able to give somebody back something they lost through surgery or injury or other trauma, an autoimmune disorder.
Yeah.
And I myself can I feel a lot of empathy because I did have a mastectomy and reconstructive surgeries.
Yeah.
So it really, can be, I mean, I don't know if people talk about this a lot, but it can be physically and mentally, taxing on
Yeah.
artists,
Yeah.
especially when you see some cases that, some I can't help,
Yeah.
or they may have to wait a year
Yeah.
before I can even touch their skin. And
Yeah.
want to be better and feel better, and I want to help them. And I lose sleep at night a
Yeah.
lot of times over it and what I can do and what I can recommend. And so it's hard, but I absolutely love it. I mean, I love seeing that final result when we do get there, and just ask people to have patience with me on the journey, because sometimes it is a journey of a year, or longer.
I think one of the things that isn't necessarily talked about in paramedical tattooing is that results are not given like how you could anticipate results with a brow or a lip blush.
Right.
And because the canvas is never the same, I really try to manage expectations and it really discuss that this may be 2 treatments, it may be 6.
Right.
And I think that even for the paramedical clients, their expectations are usually never perfection. It's something that is some percentage of being improved. And I think that's one of the things I really love about these procedures is that, you know, even if there's a marginal change, a lot of times that is enough for them. It's enough for them to get the confidence back or feel that, you know, they're not looking at it every day. And even within that, I mean, sometimes that's all they want. And if we can get them an even better results, fantastic.
Yeah. It's funny because after COVID happened last year, I mean, it presented so many challenges.
Yeah.
And one of the things that I benefited from in my business was the ability to do virtual consults because I really wasn't doing virtual consults anymore.
Yeah.
You know, back then I was doing 2 separate consultations in person.
Okay.
That's a good thing, but it's also can be a not so good thing in that when you see them in person, even after they sent you photos and you've had the consultation and maybe you've seen, you know, their breast or their scars or whatever on the virtual,
Yeah.
they're in person and you start tattooing, maybe their skin turns really red and sensitive. Like, did you forget to mention something on your medical history form?
Right. Yeah.
So they'll be like, oh, I have psoriasis, or
Yeah.
and you just really have to be able to adapt.
Yeah,
You
you do.
Well, that's cool. You know, chemo brain is a thing. It's for real.
Yeah. Yeah.
Fine. But you have to know how to adapt your technique. You know, your needles. I personally, some people use 3 needles and that's it. But I have a bunch that I put out on a separate area. So when they get there, I look at them and I'm like, okay, these are the ones I want to use. So I'll go grab those and then bring them over to my tray.
Yeah. Totally, like just getting away from that for a second, but I just wanted to ask you, are you okay from your cancers and how did your mastectomy turn out?
Well, I had some issues and I ended up having 4 revision surgeries. I was hospitalized with an infection for a week after my 3rd surgery.
Yeah.
So they had my 4th surgery was switching out 1 implant, and 6 months later. I actually haven't said this publicly, but I have to have another revision surgery in June. I have it scheduled for, and it's because I was instead of Alloderm, the doctor used a combination of Alloderm and Stratus, and I'm just reacting well to the Stratus, and so it has to be removed. And
just for our viewers, those are different types of implants.
No, Stratus and Alloderm are cohesive mesh, so they are. So the implants, I actually do have 2 different types of implants now. That I have a Mentor and a Rel, so that's another issue in itself. Those will both be switched out, and I'll be given both the same implant. There was just a lot of things going on, but so the Alloderm, it sort of comes part of your own tissue and made from cadaver skin. And
it's built up on the side to like kind of manage the breast.
Everything in place.
Yeah.
Put it in layman's terms.
Yes. Yeah.
So the Stratus is similar, but it's made of pigskin. And yeah, I didn't know until I read my op report that that's what they put in my breast. And it's just reacting negatively to it. It's caused chronic pain over the past 8 years. And so
you poor thing.
Finally getting it taken care of.
Oh, so that will be your 5th revision then?
Yes, that'll be.
Oh my gosh. Yeah, that's a long journey. And I think it's not uncommon for women to have maybe not 5 surgeries, but certainly get a lot of them, and they just get so burnt out and they're anti-surgery, and that even can relate to getting areolas tattooed. I think they just feel like, I don't want one more poke and prod in these breasts. And I think that's perfectly acceptable. But it's funny because I also think they sometimes come around and be like, it's been a few years, but I think I'm ready to do that now.
Yeah, surgical fatigue is real. I
Yeah,
doubt
totally.
surgical fatigue. And I said, you know what? I'm just going to deal with I'll deal, maybe I'll get another revision down the road, but right now I just want a break.
Yeah, totally. And did you get your areolas done?
I actually had a nipple sparing and
Oh,
skin double mastectomy.
okay. And
It's
did you tattoo around any of the scars?
Segum.
Did you tattoo around any of the scars?
It was completely under the fold.
Oh, okay. Sorry, I have a hair in my mouth.
That's okay. So everything was spared.
Yeah,
And now the nipples would lose blood flow and oxygen supply. They fade a lot.
yeah,
So, they can become transparent, can become white, they can fade from brown to pink.
yeah,
Everything's different. So mine did fade a lot. And
yeah,
tattoos are something that I've thought about, like areola repigmentation.
yeah,
I haven't done it yet. I want to take one step at a time, and I
yeah,
want vision surgery completed
yeah.
first. And then I do an areola repigmentation, and then I'll move forward with that.
Right on. Well, I'm sure you like know people, or you could even do it yourself.
People have asked me that. They're like, "Did you do your own tattoos?" And I'm like, "That's interesting, but it might be kind of challenging."
Yeah, it's when I had my thyroidectomy and my scar was, I mean, I was very self-conscious of it.
Mhm.
I just basically jumped in and started doing not only my own scar care that I would advise to people, but then moving forward, I did microneedling on it. And then moving forward from that, I did a bit of camouflage, and it is like virtually undetectable. When people look at my neck, they're like, where is it? And I actually have to feel the scar tissue. And yeah, it's pretty incredible when you can do the proper measures of how much of a change that can make versus, having a scar that is really obvious every time you look at somebody versus people saying, well, where's your scar, if you're telling them that story. So it's a really amazing thing to be able to give to people. And like I said before, even if it's towards the end of the journey because they never knew that existed, there's almost 99% chance of still being able to improve it to some degree.
Absolutely. And my scar's the same way. It's virtually undetectable.
Yeah.
I did have laser treatments on it, and I didn't feel like that they were that effective.
One of the things that I hear with laser, or I guess see, is that people will say, like, I'll see their scars that are quite raised, like a little bit like a hypertrophic scar, not a keloid, but they will laser it, and I have seen it flatten. Kind of taking it to the next level with a keloid and flattening it with steroids is also really effective. But the laser I've seen a few times and been like, it's not bad. I don't know how much of a result versus the cost, if
Right.
it's really worth it that way, just because I don't see it that much. I've seen a little bit of improvement, and maybe the lasers are improving, which I also find is the case sometimes, that they kind of hunker down on new technology, and then that could be something that helps. But
Yeah. Keloids are a different animal all
yeah,
on their own. I've seen some really significant keloid scars that I won't touch, and I
yeah,
refer them to. Fortunately, I work in a doctor's office in New York, so I send them to the doctor.
yeah. Do you camouflage keloid scars at all?
I have not camouflaged a keloid scar.
I see sometimes on social
They're,
media
they're
people
black
doing that.
and they're dark. The people that I see keloids on the most are black skinned
Mm-hmm.
clients, and so the keloids are really dark.
Yeah.
But I haven't had any white clients that I've seen with keloid yet.
It's funny, same thing here. It's black skin or very close to black skin, which is just genetically they're
Mhm.
predisposed to that. I have had a couple just Caucasian women come in with keloid scars, and I've done a little test patch on them because I'm wondering, like, can I camo or color correct a bit of this? It's like you said, it's high risk and something that you wouldn't want to proceed unless you had a lot of experience, because you can certainly make it worse, and that's the opposite of what we're trying to do.
Right. Yeah, and it could easily be activated if you're not careful.
Yeah. Do you do vitiligo? Tell me what else you have under your umbrella of
Yeah.
paramedical other than areolas.
Yeah, so vitiligo, I've done on black and white skin, a
Mhm.
camouflage. That's, everybody's different. I usually prefer the vitiligo to be active or inactive for 7 or 8 years before I'll even touch it.
Oh,
So
really?
I feel like if it's active, when you do the tattooing and the camouflaging, you can reactivate it if you're not careful.
Yeah.
I would,
I found with vitiligo, as per a doctor's, actually multiple doctors' recommendation, that if it's been dormant for a year,
okay.
it's usually safe to move on to a camouflage. In chatting with people, I always say, like, there is a chance this could activate it, and have them sign off on the release form. Most of them are actually really willing to take the chance. And some of them certainly have had, no vitiligo for longer than a year. And I'm always like, okay, that's even more reassuring. But I've also had people that they're that year in and off we go, and it's great.
Yeah, it's such a great procedure for people with vitiligo. And like you, I do a test patch.
Yeah.
Just do a little area, make sure that it doesn't activate it and that it matches,
Yeah.
I haven't had anybody come back with significant fading, but I have talked to some other artists who said that they've had issues getting the camo to stay. Have you
Mm.
experienced with that? Where you,
Yeah, so one of actually just posted a photo. Vitiligo client that I just had, well, they have a lot of vitiligo, but one of the latest spots we were treating was like just into his hairline. And so I did a test patch because I've been working on his body, so I kind of knew what colors to use. And the first round that I did, I saw him come back, and it was actually quite pink. And I was like, oh, okay, well, this is this is an interesting result. I just went back in and did another session on him. This is actually 2 to 3 months later. And I feel like, I don't know if it was the needle depth or just how his skin responded. Like you said, it's just always, you can never really 100% put your finger on these cases because they're usually all so different. But I feel comfortable now moving forward with his camouflage. And yeah, I think it will be great. And again, like, if it's that blend that it really minimizes that transition, then all all good.
yeah. Another client base that I've seen that's kind of grown for me is um, like anybody that's got a serious burn. I've been doing a lot of that, doing microneedling, which I think is an amazing procedure to break up that scar tissue and really build up the collagen to help flatten and minimize the scar. So that's something like the clients who have approached me, they're like another client that has had laser treatments. And so I'm like, well, let's try this and see
Yeah.
if it seems to be working really well.
I find with burns too, that is especially does not seem to do well with laser. And microneedling, or even just putting a bit of pigmentation in the hypopigmented areas of the burn, can really soften the appearance of it, because it's just that contrast that you're trying to simmer down. And when you do that, it really can start to neutralize or just get them like, hey, this is 70% better kind of idea.
Right. And they're happy. And that's
Yeah.
what, I mean, it really is all about kind of working together, managing expectations, um, and just making them feel better about themselves and hoping that, you give them a pleasing outcome
Yeah.
and they'll be happy with for years to come.
Yeah, agreed. I was going to invite anyone who's on with us, if you have any questions, just to fire away, and we're happy to answer throughout. I know as the conversation gets on, sometimes people will miss them, and then I want to make sure we can answer as many questions as we can. So, Marty, tell me how you keep the excitement and motivation alive with your business through COVID. Have you done anything out of the ordinary?
Just setting up the virtual consultations. That has been the main thing that I've done differently.
Yeah.
That ended up working out even better for me. So, like, since I travel so much, having the ability to do those virtual consultations really takes a lot of pressure off me.
What does a virtual conversation or consultation, what is that conversation for you? What does that look like?
Um, After we get online, depending on what kind of service they are looking for, I'll go over the date of their last surgery, for example, if it's areola tattoo. So get the necessary basic medical information. And then the more comprehensive information will come when I send them. If we decide to go forward, I'll
Yeah.
send a package with, the full medical forms,
Yeah.
the procedure forms, the aftercare forms, all about the forms, right?
I know. Forms, 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 forms.
Yeah. So it's usually about a half an hour, and I'll go over their basic information. I will look at the area that they're concerned about, determine whether it's something that I can help them with, tell them how many sessions I think it might take, go over the pricing, and then we'll determine if they want to move forward. For there, then all the forms come by email. And
Awesome. Okay, we have a couple of questions. I just don't want them to scroll through. Okay, CG Cosmetic Tattooing. How do you go about pricing your camouflaging, one lump sum upfront or each session? I'll tell you how I do mine. How does yours go?
mine is per session.
Oh, okay.
Yeah, it depends on the location. Let me take that back. So in Pennsylvania, it is per hour.
Okay.
Here in West Virginia, it's per session, and in New York, session.
Okay, so for me in Calgary, if I'm doing paramedical, what I like to do, and I always think like it's so great to hear what other artists do as well, because I typically price it as I'm going to get you as happy as I can, and if it takes me 2 or 5, it's the same price. I just like I really like the other model that you have. My only thing is, do you feel like some people in doing that go, okay, whatever, it's fine, when you could have maybe got them a better result, but they didn't want to come in for one more session?
Well, I try to manage their expectations
Yeah.
when I have the conversation and say, this might take 2, 3 sessions. And what we can do is evaluate how you look and feel after the first session.
Yeah, definitely. I actually really like that because it does sometimes backfire in the sense that if they're coming too much and it's just like their expectations of it has kind of changed, and I need to really sort of get that back in line to say this is as far as I think we could go, because what ends up happening is we'll take a step back. I'm going to damage or scar or remove color, and then we're starting a whole nother process again. So I do really like that model of doing it per session.
And so if they want scar camouflage, because sometimes they don't know what they want. They don't know what scar camouflaging is. And they'll be like, well, can you camouflage this? And it's red and raised. And I'm like, no, why don't we do some microneedling first and see how that heals?
Yeah.
And do scar camouflage.
No, go
ahead.
One of the most common questions I get, and you might get this as well, how have you established pricing for these services? Is it something that you look as a market, or do you feel like I compare it as to like what's going on in my country and price? How have you been able to do that for yourself?
So I look at the different markets.
Yeah.
And what my pricing is different than in New York.
Mm-hmm.
So but in Pennsylvania, they already have their set pricing, so that's fine.
Okay.
But yeah, I look at the markets and plus my travel expenses. Then I have insurance, licensing. So there's all kinds of layers of expenses that you have to take into consideration for each location that you're in on
I
the
think
business.
yeah, I agree. I think one of the things that I talk a lot about too is insurance for these procedures is quite a bit higher than being a PMU.
Mhm.
And a lot of people even struggle with getting insurance. So I don't know how this is for you, but for me, it's a persistence game. It's about calling as many companies as you can, getting as many quotes as you can, and then moving forward like that. Because this year, actually at the beginning of the year, I had to renew my insurance. And because of COVID, my original provider said, we're not covering anymore, which is just like, okay, they've been my insurance company probably for the last 5 or 6 years, and then it changes because of COVID. But I looked around and I literally had quotes that were like 100%, like double what I would get, which blew me away. So I think it is so important to shop around.
Yeah, I use PBI if anybody's interested in their information.
Oh,
Just
okay.
they're really great, and I can send a link.
Absolutely. I'd love to post that. I just got a question from Art Tattoo Jamila, if I'm saying that right. I hope so. If not, I'm sorry. Is it better if we introduce some serums with the micro needling and a scar treatment? And what is the best serum? How do you handle that?
I do dry healing.
Okay.
I,
I and dry healing, do you like that? Do you ever add antibiotics or anything else to them?
no antibiotic ointment. After, depending on what the procedure is and the extent of the procedure, after a few days, if it's, after it's healed, then I'll say you can incorporate some moisturizer.
Yeah. I think there's such different perspectives on that with people from, I do a medicated wet heal on specific things. Then I'm a bit of an advocate for dry healing on specific things. And then for areolas, I use Tegaderm. Do you
That's
use
what
that? That's the easiest way to do things, but it doesn't always work. Like some of the cases, it's just like this, A, the Tegaderm bandage isn't going to stick, or B, it's not just the exact right way to heal this. So it certainly has its place, but when I can use it, it's my favorite.
So what I've been doing for my areola clients is after they remove the Tegaderm, initially I was saying you can use Lubriderm to keep the tattoos moisturized. Sometimes they do experience some flakiness and
Yeah.
peeling. But I discovered the microbalm areola. Have you heard of microbalm?
I have not. Is it just like a beeswax base type aftercare?
Natural sort of salve, and it has CBD. It's got lavender, chamomile. It's all natural antibacterial properties, and my clients seem to really love it. I mean, I've had clients say they use it on after they're done using it on their breast, they put it on their lips and
Yeah.
cuticles. So
There's a few out actually that I've been experimenting with. I do like a lot of the aftercares that tattoo artists will suggest when it comes to, okay, this is healed, but it's getting a little bit dry and flaky. They have all kinds of different ingredients from the ones that you've listed, although I've not heard of CBD, so that's a cool add-on, from arnica to beeswax to coconut oil, those types of things. And I think honestly, it's if you're giving them something to deal with the dryness, I do think it's important because I do think any sort of scabby, excessive flaking can affect the results of the tattoo and not in a positive way. So that's kind of been my approach. I feel like we didn't 100% answer that questions. Do you microneedle with serums?
when I do pro-cell therapy, yes,
Okay.
stem cell serum.
I use when I microneedle, I came across a container that has hyaluronic acid on it.
That's
And
great.
yeah, so I do one of two things. Sometimes I will dip an hyaluronic acid in, or if I've really like done a pretty aggressive session, I'll just use the hyaluronic acid after, massage it in. And I think that just gives it an extra boost. I mean, it would be interesting, say if we're working on the face, to do like half with and half without and see the difference, because we never really do that. You know, it's like, I did this, did it turn out better than if I didn't? It's, you know, something that you don't necessarily have the answer to. But I think a lot of those things certainly don't hurt, and it's stuff that you can kind of play around with. And I think the market is always reinventing new things that we could potentially be using. It's funny, I'm usually the guinea pig. Like, I like to test things on myself because, you know, I don't want to just go in there guns a-blazing and try something on somebody and make them feel like I'm being a bit reckless. So I test it on my girls that work, and I test it on my family if I can. And that gives me typically all the information I need to know. And I think Paramedical is the best for that, because you're not tattooing brows on a face. You're like, oh, sorry, I kind of messed those up. Test spots with Paramedical are often, you know, either never seen, or if you didn't get a good result, I will be like, okay, I needed more, or, you know, whatever the things were, deeper, more color, darker, whatever. And then if I have something that's been too dark, I love the challenge of then either correcting that or feeling like, okay, what can I do to reverse that?
What do you use for removal?
A lot of times I just go in and microneedle.
Okay.
And try and pull out as much of if it's like a little bit too dark. And a lot of times I feel like if something is not exactly the right color, it needs a bit of time, because a lot of that can just often change if it's, you know, give it 90 days kind of idea. And if something wasn't, the client wasn't happy, or we needed to adjust, it's like, what is it? It's a little bit too dark. It's a little bit too like red or peachy. It will determine whether I should go in there and very lightly camouflage and just sort of like watercolor a light veil over top of that. So more case by case, if like how things have gone sideways. And yeah, I mean, even I just launched an areola online course, and one of the things I showcased was doing an areola.
Having a doggy.
Oh, that's okay. Ask us any questions, you guys. Let us know if there's anything we can attack for you.
It's his about their dinner time, and so he always goes crazy.
That's all. I love dogs.
Okay, so my dog's gonna start barking around 4:30, 4:40.
It just adds some extra excitement.
Yeah.
Okay, what were we just talking about? I can't remember. I lost my train of thought. Do you remember?
We were talking about testing ourselves, and
right. And then we were talking about corrective type stuff.
Right.
What do you do for if something has come back not exactly what you had anticipated?
Well, I've done exactly what you do before, and I also am now certified in lift pigment removal.
Oh, right on.
Yeah.
How do you like that?
Well, I just got certified about a month ago.
Okay.
And so I've done 2 clients, and so far it's going pretty well.
Awesome.
I mean, significant improvement in, you know, the pigment being lifted out of the skin. So, but one client, actually I've done more than that. I'm sorry. I've done 4 so far.
Okay.
One is very dark, microblading and scarred,
okay.
Which is a challenge in itself. Anyway.
That's another live.
Yeah, that's something else. You know, then I have a couple more that just have old tattoos that have turned red or green, and that just needs to be pulled out. They can't be corrected without corrected.
I just got a phone call coming in.
Do you ever microneedle pigment into anything? So that's like scar camouflaging?
Do I microneedle?
It was a question that came across.
No, I don't. The only thing I've microneedled into scar tissue is hair strokes at the very back from a facelift. How about you? Have you done the same?
No, I do scalp micropigmentation for any areas on the scalp, but no micro.
I feel like the hair strokes with the way this scar was, is it was kind of pulled out, that the just if I was just doing regular SMP, that would have pulled it out, but not made it look as realistic. I don't think the micro pigmentation or microblading is the best way to attack that. I don't think it lasts that long, but it's sort of playing around with different results and what you can get. And then maybe it needs a little bit of stippling in there as well. But again, just trying to, put all your artistic skills together to get people the best result is usually how I look at things. One of the other things, Marnie, I just remembered, I had a brain fart about what we were talking about. So I had an areola. It was a unilateral, and she had the most washed out translucent areola left. And just like how we were saying, after surgeries and the rest of it, a lot of that pigmentation changes so much. Like it gets lighter, it sometimes gets pinker. It does weird stuff, but I find one of the trickier things to match is a really translucent areola. And in doing that, because I was being like really light and diluted in the rest of it, she came back and she had barely anything. And I think it is important to showcase that stuff because people always see typically quite perfect results or close to, and I think it's intimidating for people and it keeps them from wanting to get into paramedical. And it's like people never showing healed work. It becomes, a very skewed impression of what things should look like and what they do look like. And I think it is, it's important to even not only talk about it, but to show pictures of it. And I think people just don't do that because they're a little bit, scared or embarrassed or, not sure. I mean, the internet is not a kind place for sure, but as someone who does teach online, I do want to show like, hey, this didn't turn out how I expected it. Or this didn't come back with any color. And it's because I am conservative and I'd rather deal with that than someone who comes back and they've got a super solid opaque areola. And now I'm on to then tattooing the other areola to match. And, that becomes a little bit of a revolving door.
Yeah, I was just going to say, if somebody is super light on one side, usually the natural areola, or they've had a breast lift on the other, and they've had the keyhole incision.
Yep.
So I say, you know what? I will do the other side for the same price if you'd like, repigment that areola and do dark camouflage, and you'll have a better outcome.
Yeah. And it does sometimes require just a bit of that tweaking on the other side just to get better symmetry. It's just not possible to, really dial that in. So it's as exact as you can get it. Sometimes it does need a little help on the other side. Marnie, I thought we could answer some of the questions I had posted on my Instagram before we started. I wrote them down because I couldn't show them on the live while we were doing it. So, okay, the question was, what's your biggest fears about paramedical tattooing? And this is not really related to the biggest fears, but it was a question about what is the best way to approach plastic surgeons? I know I work with them, you work with them. How did you navigate that?
Well, for me, I started with my own plastic surgeon.
Oh, okay. Nice. Perfect.
So I get referrals to this day from his patients, and I just sort of went from there. I said, this is what I'm doing. Asked him if he knew any plastic surgeons who have patients that might be interested in my services, or adding me to their list of artists that they want to recommend to different patients, because I think that, the patient should have the option of choosing among different artists, because they like one person's work better than another person's work. So if I were a patient, I'd be like, okay, I would like to look at these 4 or 5 artists and frequently refer artists out to places where, you know, if a patient reaches out to me and they're in a location that I'm not, I'll refer other artists because I'm totally about supporting the community and the other artists. And I want to make sure that the patients and the clients have the best possible option. So I'll do my research to find somebody. After that, my surgeon in New York, he told me that he actually went to school with a surgeon in went to medical school with a surgeon in West Virginia. So I reached out to him, met with him in person, gave him my cards. So, you know, they started giving them to their patients, and it just grew from there. I mean, you have to really market yourself,
Yeah.
get some printed, get a portfolio, put your work on your website, your Instagram page. Hope it doesn't get taken down and
Right.
flagged it. And just kind of go from there. I mean, you just really have to be diligent about talking to people, get training, continuing education. It's also important. I mean, we're constantly learning and growing. And I love going to classes. And I was really bummed that COVID hit because I wasn't able to see my peers in the industry and share the knowledge with them.
Yeah.
And learn what they have to say.
Agreed. I think continuing your education is so important, and we can kind of get stuck in our own ways of doing things and then realize that someone has, you know, come up with a better technique, or, you know, just has a completely different spin on stuff that we could incorporate. For me, in the whole plastic surgeon realm, it is totally about marketing. And then once you break into that market, the doctors talk. So then that becomes one of the main things that I felt I've grown in that regard, is that someone will say, hey, Jody does our areolas, you should check her out. I will often follow up with a call. And of course, I usually don't talk with the doctor. They're hard to get a hold of here and even pop in for a few minutes. So a lot of times I'm just dealing with usually the medical admin person that they have with the doctor, and build a relationship there, drop off, you know, portfolio books, tag them in my Instagram. And, you know, you have to market yourself. It is, people are not going to knock on your door unless, you know, you're out there putting yourself, you know, in front of them, and not just once. You know, it can often take multiple times. And I'm just this, like, I'm the squeaky wheel, you know, and that's worked for me. You know, you try to not annoy people, but at the end of the day, I'd rather them, you know, be like, oh my God, this girl won't leave us alone. Because a lot of times that's how they're like, oh, she's on the top of our mind because she just called us again, you know, at the beginning of the month. So.
And a lot of times they run out of your cards and they don't know how to get in touch with you to have you drop more off. So you have to be diligent and say, you know, give them a call and say, do you need some more cards? I'm in the area. I can drop some off.
One of the things too that I've noticed has been helpful is, you know, phoning might not be well received. So then I'll try emailing, and then, you know, a lot of times I'll get the email back, or I've tagged them in Instagram, or I'm following their page and I comment and I like their stuff. I follow what they do and, you know, engage in their business, if, you know, and a lot of times that does become reciprocated.
Right. And, you know, I think that the surgeons, they do wonderful work. And it's really important to let them know that we're available for them for the areola tattooing and the other paramedical stuff, because a lot of them don't realize that exists, and they do the tattooing themselves, or somebody else does the tattooing, and then the patient has to get corrective work. And you know, it just becomes so arduous for that patient. They should have been have a tattoo that was done right the first time.
And I think that's a very good point. And it's one of those pain points I feel that doesn't always get addressed, because they have their receptionist doing the tattoos and it doesn't go well. And those are things that we could help them with. We could really show them that the work can be so much more three-dimensional or realistic, versus, I always like to call them like pepperoni slices, because, you know, areolas shouldn't look like pepperoni slices. But yeah, that that is a common thing. I don't know if it's for you, but here it still happens. It's starting to change because, you know, not only social media, but people do recognize that there's a completely different style out there, just like there's better, you know, permanent makeup.
Right. And oftentimes I see, you know, some serious scarring
Mhm.
because of it.
Yeah.
And,
Yeah, totally.
you
Uh,
know,
okay. One of our other questions, how do you find your paramedical tattooing ages? And talk to us about picking wrong colors.
so the pigments I use are permanent.
Yeah.
Pigments used in the doctor's office.
Yeah.
So they age pretty well. I do my touch-up session usually 8 to 10 weeks later.
Okay.
People have had to have other surgeries, unfortunately, after we've scheduled that follow-up, and it's been like a year later that I did their touch-up,
Yeah.
and the pigment retention, of course, faded. That's why I always sessions, because it is compromised skin and it takes pigment different than normal skin would. So at the touch-up session, I always reinforce any areas that might have faded and add any detail and dimension that I feel like might make the tattoo look better. So the pigments stay really well. If the skin's been radiated, sometimes that does not hold pigment as skin that's not been radiated. It can be more dry and it can be more discolored. So you have to make adjustments for the pigment to the color to match both sides. It can kind of turn ashy.
Mm-hmm.
I don't know about your experience, but when I've had a client come back with radiated skin, I noticed that the tattoo looked a little ashy and I had to make some adjustments with the color.
Yeah.
But there, it was just the color that needed adjusted.
I think too, it's like when you see that, it's no different in my mind from a color theory standpoint that if something came back too ashy, then I correct it to warm it up so that it
Right.
then becomes what I want. Would have I ever started with those colors? No, but you can't anticipate if the radiated skin goes ashy, or does it maybe even do the opposite and get really warm, and then you
Right.
need to ash it out a little bit. But again, just, you know, moving with the results that you have. Do you find the colors do anything strange as far as camouflaging goes, whether it's like a scar or a stretch mark or a burn?
I've had camouflage come back a little darker than I expected.
Mm-hmm.
So I just learned to start off with a light wash,
Yeah.
you know, and I think that the reason was because I outlined, and the pigment's a totally different pigment, but so I had one client who has a condition, I can't remember the long name off the top of my head, but it's sun damage, but instead of the spots turning brown, they turn white.
Oh, okay.
Sun damage. Anyway, so did some scar camouflage on the, you know, the white areas, and I outlined them with a purple marker.
Mm-hmm.
And she came back, I think it was 4 or 5 later, and she was like, well, this looks like purple, like from the marker. And I was like, that's a different type of pigment. It's not going to stay in your skin. Don't worry about it.
Yeah.
And then I saw her a couple months later and it was fine.
Yeah. Yeah, I think a lot of the remedies to issues is just time, because it
Right.
does sort of settle in and change a bit. Just like if you compare it to the face, what starts off, you know, for example, lip, like quite vibrant, it just kind of mellows out, and that's often just what it needs. So a lot of times before I jump into anything that I'm like, okay, hey, we need to get in here, is usually it's like, here's the time. I'm here for you when this comes back. And that's where the benefit of having an all-inclusive price comes in. So I don't feel like you need to pay, or it's probably something that you just clarify, like, hey, that's on me, you know, when give it X amount of months or whatever, and then let's take another peek at it. Because I think with paramedical, one of the biggest things is just, you know, keeping your clients as happy as you can, because you know how much trauma typically has happened around that. So just, you know, keeping it a positive experience for them is so important.
Yeah, absolutely. Absolutely agree. And speaking of virtual consults, I have one at 5.
Oh, okay, perfect. We'll wrap it up. Okay, the rest of these, oh, just one last one. Color matching. Tell me how you color match.
I do swatches
Okay.
on their for an area, actually for anything, basically. I'll take a look at their skin. I'll pick out which pigments I think are going to look best. And I take a piece of like either a machine bag or barrier film if it's clear, do some swatches on the clear, film, and then put it on their skin until I find a match. If it's a unilateral
Yeah.
or a white scar, I'll just put it right on the scar because it's white.
Yeah.
So
I like to just swatch on the skin. Do you find putting it on the plastic barrier? What is it?
I mix it on the plastic so I don't have to put a whole bunch in my cap. So I'll take a tiny drop of each color, mix it with maybe some wash on the plastic with a long Q-tip, and then swatch it on their skin.
I love that. That's a cool tip.
Yeah.
Okay, well, I don't want to keep you and get you late for your next appointment. I wanted to say thank you so much for not only sharing why areola tattooing is important, but paramedical in general. I would encourage any of you guys that this speaks to get online, get training in these types of procedures. I'm sure, Marnie, you would agree that it's probably one of the most rewarding parts of your business.
Absolutely.
All right. So what do you think? Should PMUs put this in their business? Is this something you would recommend?
If it's something they're passionate about, absolutely.
Yeah, I agree. And I think it is something that differentiates themselves from their clientele or from their other competition. And it just speaks to the clientele about, how your reputation is and how you can be trusted. So if that does speak to any of you guys, check out our areola online training. I'll drop a promo code for you guys. And Marnie, thank you so much again for being a part of this. You're an absolute doll.
Oh, thank you.
All right, everybody, have a fantastic Easter Monday. Take care.